Thank you very much for this warm welcome. I'd like to start by presenting our agency. We are a body of the EU. We work towards the European Commission. The agency was established in 1996 in Bilbao, in Spain, and its task is to promote a culture of risk prevention to improve working conditions in Europe. We provide technical, scientific, and economic information to serve the needs of those involved in safety and health at work, so the actors in occupational safety and health. What is very important is that we have a tripartite board, so we always work with the social partners. The parties represented on our administrative board are the governments, the employers, and the workers' organizations that take the same amount of seats in our administrative board. And of course, we have the European Commission represented on the administrative board. So all of the work that the agency does is actually being prepared and discussed extensively with this administrative board. So what do? We do, on the one hand, research, but also we bring together information for prevention. We have set up a risk observatory for emerging risks at work, where we have different areas of work, collecting statistics, but also bringing together research information to identify emerging risks. And I'll explain I'll make reference to just a few projects that we've done. We also try to mainstream occupational safety and health into other policy areas like public health, research, environmental protection, transport, or education. And here we also have contacts with other services of the European Commission, not only those that are responsible for the social policies. On the other hand, besides research, we collect good practice examples of prevention, and we develop hands-on instruments for micro, small, and medium-sized enterprises. One of the examples that has been very successful is the development of an online interactive risk assessment tool. This tool works at the sectoral level, so sectoral organizations, either at the national level or at the European level, develop these tools together, and we provide basic support and then host these tools and provide links from one common point of reference on the agency's website. That has been very appreciated and very, very used in the member states, especially in those member states in the European Union that have very little resources to develop such tools. Here I would like to remind of the situation in the European Union. We have quite a lot of challenges that we are up to. We have 22 official languages. We have 27 member states with very different national contexts and very different industrial structures, so it might have very different priorities in the member states. So to develop our priorities in our activities can be quite a challenge. We work with these national authorities through so-called national focal points. Most of the time they are placed in ministries, but also in occupational safety and health research institutions. And they also have a national network where they involve the social partner organizations. That sometimes is also a challenge because the culture of working through social partners and having agreements through social partners is also differently developed in the different member states of the European Union. I'd like to mention last a big activity that we have. We organize major campaigns. We used to organize them at an annual level, but it's now at the biannual level to dwell a bit longer on an important topic. The current campaign, it's the second campaign that we do on this topic, is dedicated to the topic of stress at work. Our work is the work of bringing together information for occupational health and safety actors. So we do not have an inspection role, we do not have a political role, we do not develop legislation, but we bring together the information that is useful for the development of legislation. The European Commission has just adopted a new strategic framework on health and safety at work for the period 2014 to 2020. Which identifies key challenges and strategic objectives and some key actions and instruments. So it defines tasks for the different organizations means for the different organisms that work together with the European Commission. For example, there's a Senior Labour Inspectors Committee where all the directors of all the labour inspections of the different member states come together to discuss priorities, problems and issues, and where they also decide on common inspection campaigns that they carry out throughout the European Union. There is an advisory committee on safety and health at work that discusses all the legislation that is developed at the European level, and at the moment there is a big exercise evaluating the occupational health and safety legislation in Europe, which you might know is minimum requirements where the different member states may go beyond these minimum levels. So that's also quite a challenging exercise. We are also involved in this exercise. One of the three challenges identified in the EU-OSHA strategic framework is to improve the prevention of work-related diseases. And I'd like to draw your attention here to the term that has been chosen. It is not occupational diseases, it is work-related diseases. The second term that for me is very important is the prevention, which means that for the effective prevention of health problems at work, it's important to disconnect a bit from the discussions on the compensation of occupational diseases. Although the collection of statistics on recognized occupational diseases is still a priority, and although, of course, compensation in social terms is a very important issue, but for an effective prevention, we focus on the term of work-related diseases, which means all the diseases where work is a contributing factor. This, for our work, also has some importance. So this strategic framework is the basic document that also defines our multi-annual strategic program. We have aligned it to the framework, and within this strategic program, we work on an annual basis with annual management plans, and where we have specific projects. One of the strains here is collecting the evidence base, and under this, we do our work on work-related diseases. So the strategic objectives in our multi-annual plan are to provide good quality data on new and emerging risks, to provide an accurate and comprehensive picture on the state of occupational safety and health, but also to develop tools for micro and small enterprises, to raise awareness, and to mobilize the OSHA community to develop and disseminate knowledge. So also this issue of knowledge transfer to the workplaces. And we, of course, have to network because we are only an organization of 60 people and we have all the administration also to take care of. So we have to rely on a network, on an effective network in the member states. This is a bit of a challenge. Today I heard some voices mentioning some reduction, for example, in the number of occupational physicians. This is a situation that we also see in our partner countries. So that's quite a challenge also. And here priority setting is certainly also a big issue. Coming back to the topic of work-related diseases, the European Commission has published last year a report on the occupational diseases systems in the different EU countries, which shows that 26 countries have a national list of occupational diseases, but only half of them have a complementary clause opening it up to diseases that are not clearly defined in the list. These lists mainly aid recognition and compensation. It's very difficult to fit in multi-cause illnesses, and there is an overlap, and I've also been interested in the presentations today on the different figures on accidents and diseases. There's an overlap between the area of occupational accidents and diseases. Just to mention some of them, of course, it's musculoskeletal disorders, where in some national systems, some musculoskeletal disorders are recognized as occupational accidents, but there are other issues like suicide at work or cardiovascular events, sudden heart attacks or so at work that are also recognized sometimes as occupational accidents. So the difference, in the same way as has been said today by one of the previous speakers, the difference is not so clear-cut between accidents and diseases. What is also interesting is that the Advisory Committee on Occupational Safety and Health that I mentioned before has carried out a scoreboard exercise structured around different topics looking at how the different countries go about some of the priorities. One of the elements looked at here was work-related health problems and illnesses. And what came out of the scoreboard is that only 15 of the 27 countries surveyed used research results on emerging risks to define labor inspection priorities. So there's a missing link between the figures and the actual prevention at the workplace. And one of the intentions of the strategic framework and of our work is to close this gap between the two. So we are planning a multi-annual activity over the next 3 years. We will invest quite a high budget into this area of work-related diseases. It's not new. As early as 2002, we were asked to contribute to the policy discussion on work-related diseases. We set up a web feature looking at the different monitoring systems in the member states. We have short descriptions in this feature of the different monitoring systems. We've published reports on skin diseases. We made some references to diseases in the two reports on emerging chemical risks and emerging biological risks. I'll come back to these two reports a bit later. We've published a report on musculoskeletal disorders, a report on noise and hearing loss. These are just some examples of where we touched on the topic of work-related diseases. We've integrated the topic into our work on vulnerable groups, on sectors, on risk factors. Since 2002 and even before, we've also been participating in the working groups of the European Statistical Office. In Europe, this is the organization that collects statistical data, comparable data from the different member states on occupational accidents and on occupational diseases. And we've also participated in developing the information on the report that I previously mentioned from the European Commission. So what we intend to do is to close this gap, as I said, and to contribute to the evidence base for action. So our intention is to cover diseases and health problems that are not so well covered, also to cover back-to-work strategies. For example, next year we will commission a report on back-to-work strategies related to workers affected by cancer. On the one hand, there's the issue of workers returning to work who have more or less chronic conditions for some years. And on the other hand, there's also the very sensitive issues of workers affected by work-related cancer, so where the cause is work-related. Another area where we have identified a need to provide evidence, but also to provide information on back-to-work strategies are lower limb disorders. There's very little information on that area. So what's intended to be done is that there's an input into the work on instruments and tools, so a strong link to other projects that we do on small and medium-sized enterprises, but also on the development of tools, and on the health promotion activities, but also to feed into the campaigns. Some of the issues have already been mentioned here. I will not go into detail here. For example, to cover the service sectors, women, young workers, and different age groups, and also to cover issues like outsourced work or multiple jobs and workplaces. I would like to come back to the issue of emerging risks. In the presentation, at the beginning, in my presentation, what was mentioned was the agency's risk observatory. Within this risk observatory, we have developed a definition of an emerging occupational safety and health risks. This is what the strategic framework makes reference to. On the one hand, it's everything that is a new risk, so something that was previously not existent or where there was not a lot of information available, but also issues where we have rising numbers of workers exposed, or where the effects of the hazards on workers are getting worse. So it doesn't only cover really new issues, but also issues where the awareness is higher, or where things are more in the focus of attention. Some of the studies within the Risk Observatory that we've published, as I said, are on skin diseases, stress, musculoskeletal disorders, and hearing loss. We also covered in these studies other effects. So in the noise report, for example, we looked at tinnitus, because some of the member states do provide information on tinnitus. So I was wondering whether this was one of the issues that was also covered. Another issue that we mentioned there was voice disorders, because in some of the member states there are quite rising figures. In Poland, for example, there are rising figures of voice disorders, also at industrial workplaces. These are some of the figures that come from the ILO, also mentioned today in the first presentation opening these events, looking at the different issues, the fatalities caused by work. On the one hand, fatal accidents, and on the other hand, work-related illness. I won't go into the detail of these figures, but what they do demonstrate is that illnesses are quite a factor for the fatalities, and that the actual figures that we have from the recognition and compensation do provide a very different picture from these figures that are based on the estimates of the burden of disease. We have just published figures also on methodologies estimating the costs linked to the burden of injuries. What was also mentioned today were the ILO figures, but there are other figures. Depending on the different methodologies and what was included in these cost estimations, they are based on different methodologies, and different factors are counted into these methodologies. The range is between 4.8% in Australia and 1% in the United Kingdom. So quite some differences, but in any case, quite an economic factor. And one of the messages that we'd also like to pass through this study is that the major part of the cost is borne by the workers. Also a conclusion that was drawn from the presentation today. So if we look at the costs to the workers of reduced capacity, for example, then they are high in this diagram. The different costs factors for employers, the society, and workers are shown in different colors. The blue is employer costs, the green is society costs, and the red is worker costs, which shows the Australian example because it focused mostly on the so it has the most extensive focus on the worker costs, and what you can see here is that a high proportion of the cost is actually borne by the workers if these costs are taken into the calculation of costs. So for us in the agency, what we want to do is to continue the activities on work-related diseases with the intention of having a better picture of work-related ill health and the burden of disease. I'd like to come back to the expert forecast just to make the link to the emerging risks and to the risk observatory. Some of the risk factors identified in these expert forecasts are actually exposures to new risks like nanomaterials, but many of the prevention measures that can be chosen to address the issue of nanomaterials have also been applied to ultrafine particles. So we can do prevention. We have some indication for prevention from the work that has been done on ultrafine particles. We find issues like man-made mineral fibers. We find dermal exposures, again a new risk in waste management, and one of the issues that was identified by the experts that were surveyed in this exercise was the poor risk management in micro and small and medium-sized enterprises and the subcontracted work. So when we survey experts, this was a Delphi survey conducted among experts, what we see is a mixture between old and new risks are regarded as emerging risks. Coming back to this definition of emerging risks, I'll show the same for the biological agents. Here again, we have global epidemics, which is maybe a new risk, but also things like Legionella or drug-resistant microorganisms that are newer issues for the workplaces, and maybe also endotoxins. One of the things that we also did, we had today some presentations on the burden of disease in Quebec linked to work, and we looked at different studies on the burden of disease and which were the topics that they focused on, and also whether they had a link, whether they actually linked to prevention measures. What we could see when we looked at these burden of disease studies is that they were actually dealing with high prevalence diseases like asthma and COPD, so respiratory diseases. We also found cancers, so a bit the same as the research study that was presented today. There were other diseases that are quite important, like cardiovascular diseases and especially musculoskeletal disorders, but also noise-induced hearing loss that in Europe is also a high factor for costs, and we have high figures amongst the 5 most frequent diseases in all the countries that are hardly estimated in these burden of disease studies. And the same for skin diseases. So here again, the research, but also this burden of disease research focuses always on these same topics as cancer and respiratory diseases. Why is that so? Our interpretation is that there is a lot of information also from the exposure side, and that for the estimation of the burden of disease, you need exposure information. So it perpetuates a bit the priorities in the research. While we have information, we have the estimation of the burden, and then we focus on these topics. And where we have little exposure information, it's not possible to really estimate this burden. Another issue is, for example, that we have very little on mental health disorders, but I will show a few figures on mental health disorders. I'd like to conclude this slide by saying there was also very little data on gender and age, which would for prevention be important information to have to really do effective prevention. Looking at the mental health disorders, we have a few figures from Nominen and Karjalainen from the Finnish Institute of Occupational Health, which found that they represent 4% of occupational mortality in Finland. That was a study from 2001. And they also looked at neurological diseases like Parkinson's disease. But there are very few figures, and there's not really a lot of recent research on this. There are many things that are not considered in the burden of disease studies, and these are some of the priority topics that we would like to concentrate on. We have already looked at reproductive disorders, and we are currently revising a report that we'll publish at the beginning of 2015. But there are a lot of other topics that would be worth focusing on, especially linked to work organization and multiple exposures, but also issues like lower limb disorders or neurological disorders linked to chemicals exposure. I already mentioned tinnitus and voice disorders, things like cardiotoxicity, and of course the combined exposures. Some newer approaches in the burden of disease studies do look at preventive action, and this is a recent example from the UK, which looked at forecasting scenarios for attributable cancers linked to exposure to shift work. So they looked at different preventive scenarios of limiting the years worked in night shift work and what the impact could be on the forecasted numbers of attributable cancers. Of course, in all these estimates studies, it's not important to have the exact figures, but what is important is that this is information that can promote prevention and that can demonstrate that if something was done at the workplace, sometimes simple measures, then cancer cases could be prevented. Within the multi-annual project, what we intend to do is do state-of-the-art reviews. We will publish this year a review on exposure assessment of exposure to carcinogens. So some of the research that was presented today has been included in this review. We will also publish a review on reproductive risks at work, not only chemicals, but also other risks at work. With these reports, we publish short summaries, and we offer these summaries for translation to our focal points. We now follow a portfolio approach. We used to translate everything into the official languages, which was a huge task. And from some of the countries, we got the feedback that they have a lot of resources, and some may be in competition with their national publications. So we now offer it to the focal points, and they have a kind of a portfolio where they can choose the different products that they want translated in their national language. I should say that for the cancer and the reproductive disorders, there was a lot of interest also from the larger countries to get the summaries translated. We have just published an OSH wiki. At the World Conference, we launched our OSH wiki with a basic set of articles. This is open for authors from other countries, so I would like to invite the Institute maybe to participate in the OSH wiki. We would be very interested to cooperate with organizations also outside of the European Union. We organize seminars, so that the IRSST has just been represented in one of the seminars on the burden of disease that we organized in Brussels, and we also have some good practice articles that we will publish, for example, on the rehabilitation related to cancer. So I already mentioned these two reports. We had two seminars to discuss the topics of reproductive risks and cancer, and you can find the summary of the seminars on our website. Related to work-related cancer, just to demonstrate how on one topic we do different activities, we've done a member state survey and report on the occupational exposure limits for the CMRs. We were asked by the European Commission to do this, to feed into a discussion on the re-evaluation of the carcinogens, of the European Carcinogens Directive. We have organized a seminar that I mentioned. We publish now the report on exposure assessment methods, and we will do a report on rehabilitation to cancer. So different activities from the different areas that I mentioned before. So for 2015, we plan under the topic of methodologies to commission a review on alert and sentinel systems to identify emerging work-related diseases. At the seminar that I just mentioned on the burden of disease, we had a very interesting presentation on two systems at the European level, identifying case studies of emerging work-related diseases, and at the European level, so two very similar systems, sentinel systems. We are going to do a review on diseases linked to exposure to biological agents, and under the heading Good Practice, the Back to Work review for workers affected by cancer. For all of these different research activities, we also organize seminars, and in a further step, we will organize seminars at the national level. So here, our focal points also have the opportunity to ask for speakers to participate in national events, to present some of these topics, to stimulate a bit the discussion on the different topics. So this is a list that I already mentioned before on the different issues that could be targeted by our project. It's quite a challenging task. We are starting with biological agents. We've already done something on cancer and reproductive disorders. We'll probably focus on neurological diseases in the next step, and then we still have to decide whether, for example, we do something on voice disorders or on sensory disorders. Just to conclude my presentation today, what we've identified what is needed in the area of work-related diseases is to improve the statistical data collection. For the moment, we do not have European harmonized data on occupational diseases. There was a pilot data collection that ran over several years, where, as far as I remember, 7 countries have participated, but it proved to be quite a challenging exercise to have these harmonized figures at the European level. So there's an ongoing exercise over 4 years to find a common methodology. And the difference now is that this data collection in Europe used to be a voluntary exercise, as well for the occupational accident incidence as for the diseases, but with a new statistical regulation, it is becoming an obligation. So the member states, said 27 member states and their statistical institutes and their health and safety organizations, sometimes the social security organizations, have to decide on a list of diseases, on a list of parameters, and on the modalities of transmitting these data to the European Commission. This is why it takes a period of 4 or 5 years to agree this frame within which this data will probably be collected at the European level. I think it's a very important thing to have this data, and we've used what was there, we've used very effectively in our campaigns. It does support discussions and does give a picture of the issues. What also we find very, very rarely is a long-term evaluation of actions. So even for awareness-raising actions, we very rarely have an evaluation of whether this has had an impact at the workplace. Again, at the workshop that we've organized in Brussels a month ago, we had a presentation from the UK. Where the HSE organized 2 asbestos campaigns, and what they did, and I found that actually quite interesting, is that they interviewed workplace actors on the awareness, and they also interviewed workers on the awareness about preventive measures. In the second asbestos campaign that they organized, they tailored their materials to the results that they had from these workers' survey. But it's one of the rare examples where such an activity is really evaluated to the level of the workplaces and actually to the worker level. So what we need is targeted prevention supported by systems to identify some of the case studies. So here we hope with our study on Sentinel systems to contribute to the discussion. As I said, the evaluation of prevention schemes and campaigns, but also the long-term evaluation of policies, and this has come out of the evaluation of the EU legislation. There's very little data to support the legislation, and this data is needed. Of course, specific actions for the reduction of health problems and of some emerging health problems, some assessment linked to new types of jobs. I've mentioned the waste management, which is in the area of green jobs. We've just published a series of reports on green jobs in the energy sector, but also in the construction sector. We need, of course, better use of existing tools. And here we've made reference to job exposure matrices and some analysis of disease and death registers in our report on occupational cancer and of assessment methods. And linking occupations to specific health problems and identifying causes. There were some examples of looking at different risk factors in occupations today in some of the examples. And an issue is also the coverage by preventive services. Here again, the member states have less and less resources, and this was also mentioned today in some of the presentations. There is a shortage of preventive services. Some of these changes in the world of work need to be addressed. This has also been mentioned today, and I would like to conclude with this slide to bring in some topics for future discussions of maybe future events on these important topics, like the trend to multiple jobs, which makes it very difficult to assess exposures and to have an exposure history for workers. The move from industry to services, where the awareness of work-related diseases is even lower than in industry. An increasing number of female workers and very, very little awareness of the topic. An increasing number of migrant workers, at least we see that in Europe, because workers also, with the growing of the European Union, workers move around Europe, and there are even some very practical problems like language problems to provide guidance, to provide training for these workers. Another issue is the access to preventive services. Then, of course, subcontracting, informal work with an aging society, for example, in home care, but also in cleaning. And the combined exposure is a big topic. And, of course, the impact of new technologies like nanotechnologies, green jobs, and so on. I would like to invite you to visit the agency website and maybe look at one or the other publication that might be relevant to your area of action or of research. Thank you.